Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athlete trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this education episode, we have another interview.
And we're talking about footwear.
Yes, I think it's a topic that people know about and talk about it, but I don't feel we go as in depth about footwear as we probably should.
Yeah, there's a lot of different types, and especially when we're talking about team shoes.
Yes, I know a lot of people know about team shoes.
So who are we talking to today?
We're talking to Jordan Cardoza. He did his undergrad at Fresno Pacific University, where he was also a soccer athlete. And he received his doctorate of physical therapy from Loma Linda University. He is also functional range conditioning mobility specialist. He has worked in a variety of settings ranging from outpatient sports rehab to hospital rehab and is currently teaching physical therapy assistant students at Stanbridge University.
He's a great advocate for barefoot health and loves to work out and work on his mobility. And he is a fellow climber.
Yes, that is actually how we got introduced to him.
Was through one of our mutual friends.
So I think let's hear from Jordan.
All right, so we're pretty nerdy here, so we can't call it just an icebreaker. We like to go with cryo breakers before we get started with the full interview. So what made you become a physical therapist?
Probably similar to most other people. In the end, I was kind of injured, but I'd always knew I wanted to go into the medical field of some sort. I grew up in a real small, rural town, and at that time I thought there was nurses, dentists, and doctors. I didn't really want to be a nurse. I hated going to the dentist, so I didn't want to be a dentist because that just didn't make sense. And the few run-ins I had with MDs just wasn't. I just had some bad run-ins with some doctors. There's great ones out there, but the ones that I had run-ins with weren't that great. So instead, if I was going to go that route, I would want to be a surgeon of some sort, but that's a ton of schooling. So I ended up getting hurt in high school when I was coaching my sister's soccer team. We were out in a terrible field of grass that had holes everywhere. Twisted my ankle, ended up going to therapy. They helped me to get back to my high school soccer season, which was my junior year. And it was just a cool environment. Everyone there seemed to like their job. It kind of had that feel of, you get to work with some sports. People that are coming in and just helping people improve their overall health and fitness. So that summer, I got a job there as an aide just to kind of get more exposure into it and really enjoyed it and just kept on going from there.
Nice. That's really cool. I was going to say that definitely is what tends to be the common story as far as getting previously injured going into that route.
Yeah, that's kind of most people how they kind of go into that route, it seems like.
Well, it's a really good way to get exposed to the profession.
Yeah, get hurt.
Okay, so kind of along those lines, we like to ask the question, what is your physical therapy spirit animal? And this is a modality, rehab tool, tape, brace, etc. Any tool of the trade that represents you as a clinician.
Okay, let's see. This is a tough one. Since we're talking about footwear, I'm going to go with something of footwear relation. So do you guys know what toe spacers are?
Yes. I was a dancer, so I definitely know what toe spacers are.
Yeah, so I really like toe spacers. I think more people should use them just to focus on their feet. What's nice about them and how it kind of relates to me is, your toes, most people, their feet are very narrow, just kind of from the shoes they wear and everything. And toe spacers are meant, like you guys were talking about climbing shoes, right? Very narrow. Toe spacers are meant to kind of bring their foot back to that natural position or restore that kind of natural form of their foot. And I feel like from my approach from therapy, I try not to be fancy. I try to be very basic, strengthening, mobility stuff, some soft tissue, movement, recoordination, things like that. And the whole purpose of it is to build up people's foundation and get them kind of back to their natural form or their natural kind of where they were before their injury. So that's what I'm going. That's the best thing I could think of at the time.
I love that.
Yeah, that's perfect.
We were talking about footwear and it represents you.
Yeah.
So again, along the lines of footwear, do you have any stories or experience or maybe a case study about what really got you interested in talking about footwear or minimalist shoes in particular?
So I'll give you guys kind of what got me interested in it, and then as well kind of a story that I think goes well with kind of how footwear can affect people.
Oh, perfect.
So when I was in school, we had to do rotations, right? Inpatient and outpatient. And you see it some in outpatient, but not as much. But in inpatient, when you're working with in a skilled nursing facility or a hospital or something, you see a lot of more elderly people, and you see some feet that are just destroyed. Like all the toes are overlapping. It's just insane. And you see a few people that, don't have that problem, but for the most part, feet are bad. You see people in severe pain, terrible balance, or just can barely stand on their feet. Terrible bunions, just like the craziest thing. So I always just like to contemplate or question everything. So I was just kind of questioning or thinking about the foot in general and how older generations, right, of people, if you go even far back, right, they had no shoes. You go back even before kind of like Nike and some of the newer shoes. Shoes didn't have a bunch of foam or a bunch of cushioning or anything like that. They were basically just, here's something to protect your foot a little bit and go on from there. And if you look at the numbers as far as like running injuries and stuff like that, the shoes keep getting fancier and more quote unquote technology and everything, but yet the injury rates, nothing really changes. So is it really getting any better? So I just kept thinking, and kind of my whole process is for going into minimalist shoes or barefoot shoes is try to take them down as most natural as possible. I'm sure you guys have all taken anatomy, so you guys know how awesome the human body is and amazing how it works and all its functions. And in my opinion, your foot has more technology built into it already than any shoe, if you make the use of it. So that's kind of what led me down that route of getting into kind of a barefoot minimalist type shoe wear and just kind of focusing on foot health in general. And then a good story that I would have is I had a patient come in, maybe like a middle-aged woman, and she came in with back pain. She originally went to her doctor with knee pain, and she showed me the shoes she used to wear. They were just flat, regular shoes, but nothing crazy or anything, but just kind of flat shoes. She went to the doctor with knee pain, and instead of sending her to therapy or trying to figure out a problem, he said, "Here, go buy these shoes." And she didn't like to because they were expensive, she said. She said they were ugly, and they had this massive amount of cushion on the bottom. But it made her knee pain go away. But as soon as she started wearing them, she got back pain. So we were looking at different causes of it and everything, and basically the only thing I told her to do was change back into her old shoes. Her back pain went away, and then after that, we just treated her knee pain, looking at her like quad mobility, hip strength, quad strength, things like that to focus on her knee mobility. But just the amount of cushion and the amount of height of her heel, kind of like the drop of the shoe, it was just putting her posture and standing posture out of alignment and giving her extra stress on her back. So just by eliminating the shoes and then actually treating the problem that she had in the first place, she was good to go after that.
It is fascinating how everything's connected, how it just changed from one thing caused knee pain and then it shifted to back pain and it was all related to the shoe.
Yeah. And with shoes and feet especially, your feet are always in contact with the ground. It's kind of like the foundation. Anytime you're weight bearing, you're standing, running, walking, your feet are what starts the whole, your whole foundation and everything. Kind of like the saying of a tree, if it has weak roots, right, it's still going to be, no matter how big it is, it's going to be a weak type of thing. So, kind of, in my opinion, kind of similar in that respect.
Oh, absolutely. And I think it also highlights the importance of actually diving into other issues and trying to solve them as opposed to a quick fix like those shoes would have been for the knee pain.
Yeah, agreed. There's people who try to treat what we call the symptoms, right? They're just saying, "Oh, you have knee pain, let's fix your knee pain," versus trying to find what's the cause of the knee pain.
Absolutely.
So when looking for a pair of shoes, what do you look for? I know that you kind of talked about some different types of shoes that some have more cushion, and I know the toe box can differ. It's wide or more narrow, or some have more arch support. So what specifically do you look for?
Okay, so just in an everyday shoe, typically what we'll look for is a nice wide toe box, right, to let your foot kind of splay out, as well as kind of the ridge of that first ray, so the big toe. Most modern running shoes and just shoes in general like the widest part or the longest part of the shoe is the center of the foot, right? And our feet don't really look like that, or at least most people's feet don't, right? The longest part's generally their toe, maybe the second toe. So you would really want like a very straight first ray. So like I have a shoe here, so like that very kind of straight up and down is kind of what we're looking for as far as like the toe box goes. They say the widest part of your foot, your whole foot, should be your toes. They're supposed to be splayed out like that. So it's not much wider than the rest of your foot, but that should be the widest part. But for most people, it's not. So that's what we kind of look for, the toe box. And that's with like barefoot, like completely barefoot shoes, or like minimalist shoes. There's a couple of good running brands that have really good toe box, but aren't necessarily minimalist shoes. And then the sole of the shoe, for me personally, I like it very thin. So like 4 to 10 millimeters or so. And that's basically to allow the foot to move as naturally as possible. If you look at most shoes, they kind of bend in at the ankle and then at kind of like where like that one spot where the toes kind of bend. But if you look at the anatomy of the foot, it has about around 26 bones and around 30 joints or so. But when you wear shoes that are very stiff, don't allow that flexibility, right? You almost treat it like there's only 2 joints in the whole foot, which eventually result in tightness over time since you're wearing those shoes for, 8 hours a day or so. Your foot just doesn't get to move like it's supposed to. So generally a very thin, kind of flexible sole. And then for arch support, I personally prefer to have like no arch support. It's something that if you're not used to, you have to work into slowly. And I always recommend people, if you go from like a regular like sneaker or running shoe that has built-in arch support or orthotics or something like that, and you want to transition to more minimalist or barefoot style shoe, you have to do it slowly, like maybe just walk around in them a little bit for the day. And then as long as you're not having any soreness, increase that as you go on. But the whole premise is that kind of like they say, don't wear like a corset a lot because then you don't have to use your trunk strength and then your trunk strength will atrophy or whatnot. Same thing for your foot. You have the arches of your foot, you have muscles, ligaments that are meant to support your foot. And if all day long you're sitting on an artificial arch, then those muscles don't have to work. They slowly get weaker, which is also why with people who wear long-term orthotics, they'll typically have to redo those orthotics and get them a little bit more built up, a little bit more firm as years go by because their foot just continues to get a little stiffer, a little weaker over time. So I prefer to have kind of like no arch support. But once again, work into that. But those are kind of like the main sort of things that I look for in a shoe.
And what about like the heel drop? I'm assuming you, just based on what we're talking about, close to pretty much 0.
Yeah, 0 is definitely the way to go. There's like barefoot shoes are all 0. There's also a lot of just more minimalist shoes that have more cushion, but there's still that 0 drop, which is definitely ideal because that's what our foot natural position is, right? If you're resting. When the heel is slightly longer or higher than the front of the foot, that's when you get your foot is just in that natural state of slight plantar flexion. Typically, those people get a lot of like calf tightness over time. It's kind of like people say wearing heels for a long time can be bad for you for several reasons. Same thing, just a much less exaggerated, right? But just from that example, if you have that slight heel lift, if your body was to stay straight up like normal, but your foot was up a little bit like that, the natural projection of your body would be to be slanted forward, but to compensate, your body will just compensate in other directions. So for example, that patient that I said I had, her compensation was she arched at her back more to kind of stay more upright, which resulted in the extra compression in her back and her back pain.
Oh, that's fascinating.
Yeah, I didn't even think of that, but yeah, that would be true.
Yeah, I guess it would depend on where your own natural posturing and where your body faults. Because I think that I have a fatigue stance, so I think mine would probably be at my lower back too.
Oh, for sure. I think so, yeah.
Yeah, I think lots of people's are like that. But you'll have some patients that come in and they wear heels and that's the only time they have pain, but they're like, I'm not going to stop wearing heels. Like I got to wear heels for my job, and you just got to kind of work around it. But you do have people that'll do that to you sometimes.
Yeah, that does go into an interesting point because Randy and I were talking about this ahead of time with team shoes, because we have a lot of teams who will buy shoes for the entire team. Like the entire volleyball team, for example, has all the same shoes that they wear on the court. And it looks good, but everyone has a different foot and everyone has different needs.
And that also goes to because I worked, cross and track for a long time, is they'll do that too with their runners. They'll get, training shoes for the team. And it's just like, they're running mileage on this. I feel like there needs to be a better way than just a generic, here's the team shoe.
Yeah, I think especially for running, because like you said, there's so many miles on them and everyone has a different running style. I mean, right? So like the two main types are people that have like a heel strike running pattern and those with more of a forefoot strike running pattern. Those with a heel like strike pattern, they have to have some cushioning on their shoes, right? Because they're going to strike with their heel first. That's needed. And I wouldn't recommend someone just change just because they want to, just because it takes a long time to actually get those tissues ready and adaptable to change. But if someone is running already like a forefoot style running, right, they probably need a different shoe than someone who's heel striking, just because their natural foot strike is going to be different. And if you have a larger, say for like long distance running, like a larger heel on your shoe, especially with training and whatnot, but you're a forefoot strike pattern, it changes a little bit because you have to be able to kind of clear that bigger heel on your foot and everything. So it definitely has an effect. I think especially for running, like not necessarily some of the stuff that we talked about, but the toe box, I think for running is super important. See a lot of runners who, right, their toes are always black and falling, or their toenails are black and falling off. They're just like, oh, it's just part of running. And like, you're just smashing your toe into the front of your shoe. Like if you had a shoe, it's like the brand that I think for good running shoes is Ultra. They like promote a more foot shaped shoe. Even the bottom of their shoe has like a little foot on the bottom of it. They just have a wider toe box, kind of more space for that first toe as well. So for running shoes, if people aren't like a forefoot strike person, I would say Ultras are super good, or they just want a little bit more cushion. I run in barefoot shoes, but that's just because I have a more forefoot strike pattern. So, and I don't do a whole lot of running. So.
You're not hitting the 100 miles a week.
No, definitely not.
It's real. I'm actually really glad you were talking about the bruised toenails and along those lines. When I was a dancer, I was on point, and a lot of dancers had bruised toenails, and I never got any because, we could argue about the reasons, but I remember everyone was like, this is just part of what we do. And it's like, well, if you are paying attention, if you get the proper point shoe fitting, because there are a ton of different brands. There are some with wider boxes. There are some that the sole is stronger and it, depending on the strength of your foot. This I could probably talk about all day, but it's very similar where the footwear, it's not just part of the sport that you are thrashing your feet. I have very nice feet now. If anyone wants to know, they're not thrashed from dancing for years, and it's all part of that footwear.
Yeah, people I think just get in the mindset that like, oh, this is the way everyone says it is, so that's the way it is. And I always tell people it's worth just questioning something to see if there's better options out there.
Yeah,
I'll just always go with the flow,
I mean, that's what college teaches us: critical thinking.
Yeah.
Yeah. So speaking of footwear, and we've kind of hinted on it a little bit, we talked about like minimalist footwear. What exactly is minimalist footwear defined as, and really how should it be used?
So I kind of define it as basically a shoe that provides the base, very, very basics, and allows just your foot to move as natural as possible. If you look at the anatomy of your hand versus your foot, they're very similar in how they're in the bones, the joints, how everything's set up. Yeah, we treat them very differently, obviously, because we use our hands a lot more. But I like to think of minimalist shoes almost just like gloves for your feet, right? They protect you from, if you step on something, they protect it a little bit. Just from the daily stuff, they protect your feet a little bit. And that's kind of what they're there for. But essentially just shoes that are healthy for your feet that allow them to move naturally. If you grab a pair of like minimalist shoes, you could probably literally fold them up and put them in your pocket, because they're just meant to allow your foot to move how your foot would move. Right? Footwear nowadays, lots of times they're like, oh, we have anti-pronation technology built in, and we have this and that and all this stuff. But your foot naturally pronates during the gait and running cycle anyways to shock absorb. So if you take that out, you're going to get all kinds of, and they've done research in the different flares that they put on shoes, right? Like the in flares, the flare on the back of the foot, they just put extra eccentric load while you're running or while you're walking. So essentially, minimalist footwear just gets back down to the basics. What does your shoe need to what does your foot need just to function? And the shoe says, I'm going to let the foot do everything, and we're just going to be here to kind of protect you from any nails or something on the floor, glass, and that's about it.
So with talking about going back to like basically how your foot is supposed to function and how it was made to do so, can this be used in rehab or even preventing some of the common overuse injuries that we see in runners?
Yeah, so I think even just you're not going to. Some people think they're like minimalist style shoes because they have that wider toe box. They're like, oh, those don't look stylish, so I'm not going to wear. And that's their opinion, but that's fine. But even just walking barefoot more, right? It's going to help increase the strength of your foot, increase the mobility, increase the display of your toes. All that will combine. The display of your toes. If you watch like gymnasts or something like that, right? They grip basically with their toes when they're landing and whatnot. So it helps with your balance. So you'll improve your balance. The foot strength overall will help increase that arch support. People think, oh, I have flat feet. I was always born with flat feet. I never didn't have flat feet. And my question, like, do you really remember back then when you were that young if you had flat feet or not? But right, so just walking barefoot will help your feet to actually function properly. It'll help start increasing that strength of those muscles. And you can have a flat foot that is still very strong and supportive. It just looks a little more flatter than others. But increasing that strength, I always tell like my patients that come in with foot pain, plantar fasciitis, like posterior tibial tendonitis type pain from like maybe overpronating or just not getting good mobility in their feet. Getting into a foot that allows your foot to move will take away a lot of plantar fasciitis stuff because your foot is no longer just stationary. Your toes stretching that plantar fascia, so you're getting all that proper movement, mobility. As the foot gets stronger, you're going to get rid of a lot of that kind of any excessive pronation, right? Which is going to help with any foot or ankle pain. It's going to help prevent that knee going, right? The like knee valgus, have a lot of knee pain, ACL, which can come from the hip or the foot or both. They both have an effect on that knee diving in. So that can have an effect on that to help prevent injury prevention. And just having strong feet, like I said, right, feet are kind of like the foundation of where you're applying force. So regardless of the sport, if you're jumping, if you're football, trying to run or sprint or something like that, your foot is what contacts the ground first. And if you have a weak foot and your foot is collapsing as you're getting ready to jump, right, you're excessively pronating or something, you're not going to be able to generate as much force coming back up. So I think it has a lot of benefit to rehab as well as sports performance. Some people recommend for running going to a 4-foot strike pattern because then you get to use your Achilles tendon, right? Your Achilles tendon is huge and it's meant to spring and recoil, basically propel you forward. I read a book once and it said that animals that don't run, so animals that basically just walk, don't actually have an Achilles tendon, but all animals that sprint or run, they have an Achilles tendon. But when you heel strike, right, you don't really get to use that spring because you're not loading, and to get that recoil, right, you got to load it, but you're heel striking, you're just kind of going through the motion, so you lose that aspect of it. And there's a whole book called Born to Run. If you're into running, it's a great book to read. It kind of talks about how the modern style of running shoe was invented, and there wasn't a whole lot of science or anything behind why they invented it. They just said, hey, this will make running easier. Let's do it. So I think it has a lot of good benefit for rehab and sports performance. It just right? It takes, just like anything, it takes time and dedication to it to progressively strengthen the area and kind of get used to it. But any person that I've recommended it to, or I have some students now, they're all going to barefoot shoes, or people hit me up on Instagram saying how much it helped them. So it can definitely have a good impact on you if you're willing to kind of go that route.
I had no idea about the animals. That's kind of interesting.
Yeah, that's a fun fact.
That's what I've read. So
I mean, I guess it makes sense. I could see that.
yeah, I mean, the Achilles tendon is meant to, right, absorb load and recoil you back. So I mean, it's meant to run and jump, and the heel strike, you just don't get to use it as much. But like I said, if you're going to go to a 4-foot, if you're not used to it, even running 1 mile 4-foot, if you're not used to it, your calves will be wrecked the next week.
Absolutely.
So it's definitely something you got to build up slowly into.
For minimalist footwear itself, is that something you also have to build slowly up into, or can you change to that a little bit quicker?
It just depends on how minimal the shoe is. There's an array of different things. The main thing that's most people can get into a shoe that has like a nice toe box that's zero drop, unless they have terrible ankle dorsiflexion mobility. As long as they have somewhat adequate, they can get into a zero drop shoe pretty easily. The thing that'll change, kind of depend for most people, is like basically the thickness of the sole. So I have like some shoes that are 4 millimeters, which feel like you're wearing nothing. 10 or 12 kind of feel a little thicker. There are some companies that will make like a 10-inch sole, and they'll give you an optional like insole to put into it that'll give it an extra couple millimeters. For something like that, it's much easier to transition into. If you're not running, if you're just trying to say, I just want to get into some healthier shoes for my day-to-day shoes, which nowadays they make. When I first started looking into shoes, there was like 1 or 2 brands out there. Now there's a ton, and you can get everything from like fancy dress shoes to, anything you want nowadays. But if you're just getting into like a nicer just day shoe, I recommend just like the first day, maybe going on a walk with them, as long as it feels fine, right? Wearing them a few hours the next day, and then slowly, maybe by the end of the week or two, kind of building, wearing them for like your whole 8-hour day or so. That's what I had my wife do, and she had no issues with them. So
Nice.
And I feel like I've heard that about orthotics too. Like really rigid one is it's kind of like that same progression about just have it in for a little bit and then take it out and then just build up from there.
Yeah, kind of same thing for anything. If you're not used to something, right, it's going to affect your body differently. So you should really ease into it, but similar, yeah.
So speaking about orthotics, how would you determine if a patient would benefit from orthotic use? And I don't know if you would, since I know your stance on minimalist shoes.
Yeah, so there's like in the physical therapy rehab world, there's people that definitely need them, such as like if you have like a neurological disorder, right, where you were born with something, you have a stroke, right, or your foot is just not capable of actually supporting itself, right? So those people, you're born with some sort of, or you get some sort of structural deformity where your foot once again is just not capable of handling loads or something. Those people definitely need an orthotic. There's a couple foot or kind of issues, diseases out there that some people are born with or they get as they grow older. Those people definitely need orthotics. So what I use orthotics for, I don't mind people using orthotics as long as they're using them as a therapy tool, intervention, and not as the solution to their problem. I treat it like a Band-Aid, right? We're going to use this here for a bit, and then we're eventually going to take it off and get rid of it. So what I like to do, like say someone has a lot of foot pain and the orthotic helps, wear the orthotic, and then while you're doing that, in rehab, we're going to be strengthening your foot, working on your balance, your mobility, maybe having you progress into walking barefoot on grass or sand or something just to strengthen your foot. As your foot gets stronger and stronger and stronger, maybe you don't need the orthotics anymore and then slowly transition out of it. I think the problem comes with people are just, oh, you have foot pain? Here's your orthotic. Take it. It'll fix all your issues. And then their foot just gets progressively worse over time. And right, for a couple of years it works good, and they go back, they have to get a new one. A couple of years it works good. And once again, it's kind of whole quick fix thing that everyone wants. It works great, but it's not actually fixing any problem. And you're going to probably get other issues down the road because once again, you're messing kind of with that foundation of your foot. That's going to have effects at your ankle, your knee, your hip, your back, all the way up. But I will use them, but like I said, more as an intervention, a temporary thing, not a solution to the problem.
Yeah, that's very similar to how I assume how you also use arch taping, because if I have someone who's going into practice and, they would benefit from an arch tape, I always tell them, we can do this for now. It's a Band-Aid, but we're doing this because rehab doesn't happen overnight.
Yep. That's perfect.
Absolutely. It's a tool.
Yeah.
Yeah, that's what I like to hear.
So with going the route of orthotics, sometimes it can be very expensive and, the whole insurance stuff and that gets really complicated. So some people may want to go with, hey, I want an over the counter some kind of insole or something like that. What is the big difference between going with something that's custom, more really fitted towards your foot, and then going just something over the counter?
Is it worth the cost?
Yeah.
Unless you have one of those issues that we mentioned, like those really bad foot deformities or something, I think over the counter works probably just fine. But the custom ones, they are very expensive, and there's so many little tweaks that people can do. But especially if you're actually gonna put in the time to kind of fix your foot yourself, over the counter works great. If you're the person who you're never going to work on an exercise for the rest of your life, right? Then probably go with the nice one. But as long as you're willing to put in the work and do it, I would recommend just over the counter. They have a lot of those now that, you go stand on that pad, it'll kind of read your foot and suggest one of the ones that are over the counter still, but to use. And they have some pretty good brands out there and whatnot, and they'll provide, most people need orthotics for arch support, and most regular orthotics can kind of give that arch support as needed. And like you guys said, it's a much cheaper alternative than getting custom ones. So as long as they're going to put in the work to fix the issue, I would just go over the counter.
Nice. That's good to know. I like it. So this is Sandra's favorite part. This is it. She's all about action. What can we do today? So,
Jordan, what do you want the AT community to know about minimalist footwear?
Okay. I would say that they should know their footwear is definitely more important than they think for healthy feet and just overall health of their foot and performance. And that's something as simple as wearing minimalist shoes or just walking barefoot more often. I always recommend walking barefoot in grass or sand, be a little grounded to the earth a little bit as well, which is nice. Just something as simple as that will help tremendously with your performance. If you have pain, it'll help with that. And just overall physical health. It's probably the easiest. That's what I always tell people. In action, right? Give them something easy to take out of it. There's all kinds of exercises you can do, but the easiest thing is just to kind of get out of shoes more often, get barefoot more often, and if you're willing to, get into a more minimalist or barefoot style shoe.
Yeah, good for athletes and ATs.
Yes, absolutely.
Yeah.
So, Randy, you ready to try out some barefoot shoes?
I think I'll give them a try. I'm intrigued by them.
Yeah, I am too.
I'd be interested to see how they feel. I mean, I've had Nike Freeze, which have no arch support. I wouldn't say that's necessarily the best minimalist shoe, but that's the closest I've been so far, and I liked them.
I feel like it's you can have your dessert if you eat your veggies. You can have your no arch support shoes if you do your rehab.
Yeah, that's true. And let's be honest, I'm not doing a lot of running, so I think it'll be okay. I'll be okay.
So if you guys want to hear more about shoe reviews and PT exercises, rehab exercises, Jordan actually runs a great Instagram that I follow. It's at dr.jcardozadpt. So we'll also put that in the show notes below.
Yes, lots of great content. Lots of great content.
And if you are not part of our Facebook group yet, go over to facebook.com/group/atcornerpodcast and join. So you can connect with other listeners of the show. You can talk about more footwear. We're going to put up a question of the week. And it's a lot of fun. And if you guys are new, we do every other episode as education or stories. This one was obviously education. Next week, we're back to our stories, and I think we're going to be talking about working with celebrities or star athletes.
Ooh.
So I'm hoping that we get enough stories for this. I haven't put a feeler out yet, so I have no clue. I never know if it's going to be like overwhelming or if it's going to be like, hey guys, I need more stories.
I know. I'm very intrigued to see how this one goes. I think I got one, but it wasn't me treating the athlete. It was me meeting them, which I don't know if that's better or worse.
All right. Well, let's keep that for next week. So you got anything else to add, Randy?
Nope, that was perfect. Thank you for helping us showcase athletic training behind the tape. Bye.